Dr. John Moos is a Western-trained trauma surgeon.
Completed 4 years of medical school at UC Davis. Early exposure to impacts of a life of trauma.
2 decades in healthcare.
2 decades worth of clinical experience. Wisdom learned and wisdom earned.
Turned somatic and psychedelic healer.
Since 2019, I have guided approximately 1,000 psychedelic journeys, about 200 per year, about 100 consults per year. Average numbers of integrations range from about 150 to 200 per year.
Trauma care.
Trauma isn't just the event and what happened, what we're left with, and what we needed to survive. Trauma spectrum at the very end is the DSM-5. It's mental illness, it's addiction, it's diagnosable. But as you shift from left to right, you start to see expressions of the human condition, stories of abuse and neglect, stories of disconnection, people who feel like they're languishing, constricting patterns and self-limiting beliefs.
Overburdened ERs and surgical suites.
That pathway of deriving purpose and meaning from our life and life challenges is what gives us embodied wisdom that we earn through living a big life.
Dr. Moos pivoted towards trauma healing.
Trauma is caused in relationships, but must be healed in relationships.
Soul surgeon.
There's your life experience, there's your professional development, there's your framework and your philosophy of care. At the intersection of all of these is your authentic expression.
Healing-based sanctuary that integrates science, mysticism.
Mine is a very humanistic, trauma-informed, pragmatic, and relational model. It speaks to the medical and scientific, and it also speaks to the psychological and the emotional. And so right at that confluence is this very pragmatic, humanistic center.
Heal it before it happens, creating conditions for love and light to shine.
Psychedelics don't do the work. They're a catalyst and they're a tool. The people, the relational model, the framework, that is what allows this work to happen. Healing is diverse, people are diverse, we're nuanced, we're complex. The more languages and more models we have, the more opportunities people have to heal.